A solution is needed to resolve the abuse of authority in the BC healthcare system with Island Health. Trust needs to be rebuilt. The system is broken. The public and staff need to be cooperatively engaged to provide input and resolve the problems. Unfortunately, the word secret applies here due to some of the generic protocols that seem to be devoid of common sense. There are many secrets in the Island Health administration process. In the interest of openness and transparency, seniors would benefit from open disclosure. Withholding information is just another form of lying. Healthcare works best if problems are prevented before they get out of control. Intellectuals solve problems. Geniuses prevent them. Any problems should be resolved with an ounce of prevention is worth a pound of cure. That was very wise of Benjamin. Social workers often need help and cooperation with family members to reach a senior's care decision. That is the most effective but least restrictive and intrusive way to provide support. A simple check mark or a signature on a form can dramatically affect people's lives. This is too much power for one person to wield without significant oversight or accountability. Who are these individuals playing God and controlling people's lives?
Trevor and I started our relationship in July 1962. When I was 14 and he was 16 years old, we are still very much in love and we need to be together as we grow older. For the last 16 years, since we both retired, we have been together almost 24 hours a day. We have always been faithful and supported each other, and we always make decisions together. The situation through the past 8 months has been very harmful to both of us, physically and emotionally. Being taken from my home, confined, it feels like I'm in prison and I haven't done anything wrong. I'm very often lonely, feeling scared and confused. Trevor and I have always helped other people. We had 17 foster children and I worked with children and families in schools and in the community. We have volunteered for hundreds of hours in our Oceanside area and plan to continue to do that. I'm very concerned about how the situation has evolved, and I don't want this to happen to other people at all. Trevor has always taken good care of me and he visited me about 80 times when I was in Nanaimo Hospital. And all of the hours he's allowed to visit me in Eagle Park. When he visits, we sing, dance and walk around the small patio and do full body Zumba exercises, and they're good too. I sometimes get upset when he has to leave me alone. I phoned him, or he phoned me many times each day. We have missed out on more than 8 months of our lives together when we should have been enjoying this life. Our health and quality of life is most important to us. We need to make lots of social connections and keep active many hours of the day. We were in the process of making a music video because we've always been singing together. The music track for the video is online along with our life story book, 26,000 Days Online. Please show compassion and give us a chance to be at home again, and we need each other's company very much. When I'm released from confinement, it will be the best day of my life.
Why is Eileen locked away from her life of freedom without a reasonable explanation? She is taking up valuable space in long-term care. While 6,500 seniors in BC are on waiting lists and desperately need to be in a care home situation. Meanwhile, in British Columbia, we are in a drug crisis in BC. In 2023, more than 2,500 people died from toxic, unrelated drugs, while reportedly 2/3 of seniors in long-term care are given 10 or more drugs per day, many of which are psychotropic medications. Drugging seniors in their last phases of life is not health care. Money plays a big part in seniors' health care. BC spends over $1.7 billion each year just on residential care and assisted living services. This is up over $600 million in the last 12 years. Currently, most of that funding goes to the top salary earners. The proportion allocated to frontline workers should be increased. These frontline workers are the most important people in seniors' care and should be recognized as the principal participants. A person-centered care approach treats the elderly with respect and as individuals with unique needs and abilities. An institutional setting does not support a reasonable quality of life for many seniors. Seniors need meaningful personal contact for many hours each day. The elderly in our communities should be entitled to a reasonable quality of life. Happiness is a good indicator. To maintain or improve physical and mental health and well-being. Thank you for watching. Please like this video series and pass the word around.